Turning our attention now to COVID. We got some slivers of hope here to share about the Omicron surge in North Carolina. So check out here. You see, primarily looking at those dotted lines beginning to flatten off, leveling off. So these are the first signs of the latest COVID-19 surge beginning to slow in North Carolina. This after weeks and weeks of record-breaking cases and hospitalizations. So keep in mind, even though that data we just showed you there shows some signs of improvement, the levels are still quite high. Doctors say it is too soon to say if this is also going to be the last big spike in COVID cases. WCNC Charlotte's Kendall Morris explains why health leaders are keeping such a sharp eye on hospitalizations.
COVID-19 trends in North Carolina finally heading in the right direction.
Hoping we're turning the corner. That's what the data suggests, and nothing that's adding additional alarm right now.
The state reporting its lowest case count Monday in more than a month. But doctors say there are still some steps before this pandemic is an endemic.
Hopefully we are inching closer to that endemic state and treating it more like a respiratory virus. And there's some ways that we're already edging into that.
Doctors say the CDC shortening the recommended isolation and quarantine period is a step forward. But the metric doctors say they're watching to judge if COVID moves into an endemic stage is hospitalizations.
So as we build up protection in the community, either from vaccines, in some cases prior infection, then the cases of severe disease decrease to something manageable.
Around the world, Denmark is getting rid of all COVID measures by February 1st. The Danish government saying COVID-19 should no longer be categorized as a socially critical disease. And England put an end to its face covering requirement. Top health officials in the U.S. say eradication of COVID-19 is unreasonable, but the country has to get to a point of tolerating the virus.
Where we want to be is that sufficient control that does not disrupt us in society, does not dominate our lives, does not prevent us to do the things that we generally do under normal existence.
Health leaders hoping immunity through a combination of infection, vaccination, and boosting will get the country to a point where COVID is no longer a major threat.
Threat to our equanimity, threat to our economy, the threat to allow us to live a normal life.
As the Omicron variant shows signs, it is letting up. In Charlotte, Kendall Morris, WCNC Charlotte.